Our next speaker is Dr. Jorge Flechas. He graduated with his medical degree from Loma Linda School of Medicine. He's currently a member of the American College of Nutrition and New York Academy of Sciences and a medical director of a high-complex medical lab. He's a lecturer and he has numerous publications. Please give a warm Academy welcome to Dr. Flechas.
I need to read a disclaimer for you folks. I do not have any financial interest of any product that I speak about or any companies offering grant monies to this continuing dental or medical education program. What we have found over the years is that the number one source of mental retardation worldwide is the absence of iodine. There's probably 2 billion people on the earth who are iodine deficient, and we have been looking at this situation. And you look at, I'm pretty much like you guys as dentists in the sense that you live your world upside down and backwards. You're working on people's problems in their mouth, and you're looking at things through a mirror, and you're working upside down and backwards on these people. I live my life as a medical doctor looking at the medical problems of patients, and a lot of times in order to understand what's going on with these people, you sometimes have to flip them over mentally within your mind, and you have to look at them upside down and backwards, and sometimes you'll get a new insight as to what's medically wrong with the person rather than just going straight ahead and tackling the medical problem without seeing it upside down and backwards. We did pretty much the same thing with the use of iodine, and so today's lecture is going to be on how iodine helps with mental development, because we know that the absence of iodine gives us retardation. So we know that the body in totality has a total of about 1,500 milligrams of iodine. The thyroid gland holds about 2% of that, the skin 20%, the muscles 32%, and the fat 35%. It's interesting that if you look at human brain tissue, that the brain is approximately 90% fat. And so when they call you a fathead, you'll understand the term. But that's because there's a lot of fat up there, and there's a lot of iodine that helps to protect that fat. There are different types of iodine. You have regular iodine, which is picked up by breast tissue, prostate cancer, the stomach. There is iodide, which is the salt of iodine, and the iodide is picked up by the thyroid, the breast, the salivary glands, and the skin. But you will notice that the skin holds 20% of all the iodine. If you don't have enough iodine in the skin can't sweat. So iodine helps the skin to be able to sweat. You will see people this coming summer who get hot, and they will be able, if you ask them, can you sweat? They say, no, I never sweat. Those people are usually iodine deficient, because you give them iodine and within just a matter of 6 weeks, they all of a sudden can start sweating. But that should tell you that another concept, and that is a lot of people think that if you just take iodine and you put it on the skin, if the iodine disappears within a period of, let's say, an hour, that these patients are iodine deficient, etc. But you need to recognize that the skin is only part of a total system in the whole body that absorbs iodine. And absence of iodine in the skin, no sweating, and those people are at very high risk for development of cancer. A normal term infant, the brain weighs approximately 400 grams, 11% of the total body weight, but the brain in a newborn infant consumes 74% of the total body's energy intake. Infant brains are energy and nutrient requirements are proportionally higher in infants than what you see in adults. Survival of the fat babies are the key to an evolution of the large human brain. That is, babies are born with a lot of baby fat, and that baby fat is very much used by the brain because of the high energy consumption by the brain. You will notice there are enzymes in the body to be able to pick up and hang on to iodine. Look at this section here called examples. You have myeloperoxidase. This is a haloperoxidase that helps the bone marrow to hang on to chloride, bromide, iodine. You have lactoperoxidase, which is a haloperoxidase that helps the breast tissue to hang on to iodine, so you can put iodine in the milk. And then you have thyroid peroxidase, which is a haloperoxidase, which helps the thyroid gland to put iodine on the thyroid hormone so you can make thyroid hormone. There is such a thing called the sodium iodide symporter. This symporter was discovered back in 1996, and this is a mechanism of how we transport iodine into cells. This transporter is very active in the salivary glands and helps to pump iodine into the saliva. This transporter is the same one that's used by the thyroid to transport iodine into the thyroid gland. So if we measure the ratio of iodine in the serum as compared to the saliva, we get a pretty good approximation of how well the transporter is working inside of a person's thyroid. In newborn babies, 1 out of every 5,000 babies has got a defective sodium iodide symporter. So we know that there are certain hormones that stimulate the absorption of iodine and that help the symporter to work more effectively. One of these is oxytocin, the hormone that helps you to be able to nurse and go into labor and have children. It's also the hormone that helps you to control eye communications. You'll notice that when I speak to you guys, instead of looking at your whole body, I'm looking at your eyes. And so eyeball to eyeball communications is oxytocin control. Children who don't have oxytocin, namely children with autism, autistic children will not look at you in the eye. You'll notice that they are like this, but they won't look at you in the eye. And eyeball communications is controlled by oxytocin. Okay? Now, ladies, for you, that means that when you go out on a date with a guy and he won't look at you and he's constantly doing this, he's probably very low in oxytocin. That's not the type of person you want in your life. Okay? Because oxytocin is the hormone that helps you to be able to be cuddly and to, be a good loving relationship. If this guy can't look at you eyeball to eyeball, he's got problems. Okay? We know that TSH stimulates the sodium iodide symporter to absorb iodine. Progesterone does, retinoic acid, prolactin. This helps us to understand why prolactin, because prolactin is a hormone that helps women to be able to nurse their babies. And we've always asked a question, what else does prolactin do? And so here we find that prolactin helps the thyroid to absorb iodine. And by the way, guys, prolactin at the level of the prostate helps you to absorb zinc. Zinc deficiency has just recently been described as a reason why men develop problems with prostate cancer. And prolactin helps you to pump the zinc into the prostate, and that zinc in the prostate kills prostate cancer. So, reasons why men need prolactin, and this is one of them. Notice the following. Inhibitors of the sodium iodide symporter is estrogen, and this helps to explain why there is more problems with hypothyroidism, low thyroid disease, thyroid nodules, and goiters in women than there is in men. It's a 15-to-1 ratio. Hypothyroidism, 15 women to every 1 man that's out there in the population. And that's because estrogen is inhibiting the ability of the thyroid, of the sodium iodide symporter from being able to pump iodine into the thyroid. So as a result, hypothyroidism more common in women than it is in men. Now, iodine deficiency disorders, we talked about it. You have the woman to the left having a goiter. As you see, mental retardation, and then there's cretinism. And cretins are human beings that they were iodine deficient during the pregnancy. They got no iodine after birth for the first at least 2 years, and you see the retardation that's here. Folks, when the brain is not functioning correctly, you will see growth retardation of the individual. So in children with cretinism, they basically have problems with very low stature. So people with very low IQs are very small people. And so these people with cretinism, they can't talk, they have difficulty with speech, their skeletons are retarded, and it all has to deal with the fact that iodine deficiency to the brain will give you this type of medical problem. And so when I was down in Ecuador 1 year ago, I went down to the local farmer's market and I'd see these little people walking around. I said, cretin, cretin, cretin. And the endocrinologist that was with me said, before you call them a cretin, just go up and talk to them. Cretins can't talk. He said cretins are, when they speak to you, it's whereas a person, so I saw this little old lady and I said, I just asked her, I said, how old are you? And she said, I'm 84 years old. And I said, are you married? She said, I lost my husband 20 years ago and I've been single ever since then. And then she looked at me and she said, are you interested? And I said, no, but thank you. But, the endocrinologist looked at me and he said, as you can see, she's got a timeline. She knows how old she is, how long she's been a widow, and she can speak. He said, cretins can't do that. And so he said the cretin has an IQ of down to about 50. And as a result, he said, you'll see this. Look at the skeleton of this guy here. His skeleton is the skeleton of a Neanderthal. You will find cretins up in the mountains of the Andes, but you never find the skeletons of cretins down near the ocean. People at the ocean eat fish, they eat seaweed, they eat things like that. They have nice tall skeletons, big tall people, etc. But the people up in the mountains have no iodine. As a result, they have this problem with cretinism, and that's the skeleton of a Neanderthal. And you will, if you look at archaeological findings, you'll always find the skeletons of Neanderthals up in the high mountains or deep into a country like Central Africa. But you never find these type of skeletons down near the ocean. Now, you see this is a goiter. Goiters can be hypertension hyperplasia, lots and lots of thyroid gland, that's iodine deficiency, versus goiter secondary to hypothyroidism, where there's a lot of TSH, and the TSH stimulates the thyroid to get bigger, bigger, bigger. So that one of the key marks of iodine deficiency in a goiter is the fact that the goiter is hyperplasia. There's lots and lots of thyroid cells in the gland of a person with that. You'll notice here, this is a cretin. You'll notice her forehead very small forehead. People who have very high intelligence, you will see the forehead get higher and higher and bigger. But she's got the characteristics of myxedema. Notice the thick tongue. And people whose tongues, this should be a part of your regular exam. You should be able to look at a person's tongue at the time of an exam. If they've got a big tongue, the tongue extending from one side of the lip to the other, and there's scalloping of the tongue, that's usually due to low iodine, low thyroid disease, and they usually got big tongues. Skinny little tongues where you can take a finger and put it between the tongue and the lip on both sides, that usually is a tongue that is someone who's got plenty of thyroid or plenty of iodine. At this point, I'm just going to ask you to look at your next door, your neighbor right here, and stick your tongue out at each other, and let's see, and just kind of get a good look at it. Okay? You will see that in a lot of people, the tongue extends all the way out to this side, and you'll see the scalloping of the tongue. That basically tells you big tongue inside of a small jaw, and that tells you possibility of iodine deficiency being present. These cretins, they have very big tongues, and they have problems with that. We have noted for years that iodine deficiency will give you not only a goiter, but because of the hyperplasia of the thyroid, that these patients will go on to develop thyroid cancer. And so it's not unusual for somebody with a goiter to have problems with cancer of the thyroid. Risk factors, there's a paper that's been published, and here's the reference for that. The breast tissue is very dependent upon iodine for normal formation. Lack of iodine, you get into problems with cyst, problems with scar tissue in the breast, and you'll notice epithelial and apocrine hyperplasia. Just as we see the hyperplasia in the thyroid, you'll see the hyperplasia of the breast. And this condition right here affects 94% of all the women in North America. So that this is iodine deficiency of the breast, and this is one of the known reasons as to why women go on to develop cancer of the breast, is because of the hyperplasia due to the absence of iodine. This problem disappears when you put women on iodine. Another fibrocystic breast disease has been shown to have an increased problem with breast cancer. Again, hyperplasia as the source of the problem. We see the same problem inside the ovary. The ovaries are very iodine deficient, normal, and when you don't have enough iodine in the ovaries, you get cyst, scar tissue enlargement. A normal ovary is about the size of a small almond, and women with polycystic ovaries have these monstrous ovaries about this big, filled, and you'll see a big, large layer of scar tissue on the outside, and this is what that scar tissue looks like against a bowel, and it tells you that this is an ovary that is loaded with scar tissue, just like what we see in the breast, and this problem resolves. Iodine kills scar tissue, and it helps the ovaries to return back towards normal within a period of 1 to 2 years. So we've had 15 patients in the practice who have polycystic ovaries, were having infertility problems, started taking iodine within a period of about 20 months. Out of the 18 patients that had the problem, 16 of them went on to become pregnant. Polycystic ovary is a very common cause of infertility here in the United States. And again, women with PCOS have a much higher incidence of problems with ovarian cancer as well as breast cancer. Again, hyperplasia due to the absence of iodine. We have found that iodine deficiency is also seen in Europe as a source of stomach cancer. Again, you need iodine to be able to make the acid in the stomach. This is a board question in the field of gastroenterology. You need iodine to make acid. Lack of iodine, you get achlorhydria, you get problems with very dried stomachs, and then the problems with the lack of acid. Iodine deficiency in Poland was found to be a source of stomach cancer. Cancer is a generic term. It represents more than about 100 diseases, each one with their own etiology. Cancer risk is influenced by both genetic and environmental factors, including dietary habits. Folks, I just read a paper just recently showing us that 90% of the cancers that develop here in the United States is due to chemical toxicity from the chemical soup that we're living in. This is not a very healthy environment. Since 1938, we have introduced into the American environment close to 4 million new toxic chemicals. And these chemicals are having their effects upon us. How many of you know, if I said the word Cancer Alley, how many of you know where Cancer Alley is at?
Louisiana.
Right? In fact, Cancer Alley is from St. Louis all the way to New Orleans, and the cities at 50 miles from each side of the Mississippi River that pull water from the Mississippi to their community water sites and so on, those communities have a very, very high incidence of cancer as compared to the rest of the nation. If the rest of the nation has an incidence of breast cancer that's equal to 1, the women that live along Cancer Alley from St. Louis down to New Orleans, 50 miles each side of the river, those women have a cancer rate that's 10 times higher. Why do you think we have St. Jude's Hospital in Memphis? Very high incidence of cancer among the children that drink water from the Mississippi. And, that's Cancer Alley. So it's the chemical soup that we live in, but 90% of all the cancers that we suffer with are due to the chemicals that we're putting into our bodies. Iodine helps to control unregulated cell division. Let's look at the problems of cell division. Iodine is an inhibitor of cell proliferation, and it can arrest the cell cycle at G0, G1, and G2 mitosis. Now, look at this. This is interesting. The parts in the blue of this cell cycle are where iodine freezes cellular division. If a cancer cell is to grow, it needs unregulated cellular division and multiplication and so on. Iodine freezes these cellular divisions so that in essence, cancer cells think of themselves as being immortal. They can divide and multiply as often as they want to and do whatever they can, damage they can. Iodine comes in and puts the brakes on and induces apoptosis. Iodine takes away the immortality of cancer cells. All right? So, and this is part of the reason right here is the fact that iodine has the ability to arrest cell cycle division and keeps it from progressing. And if a cancer can't progress and do this, you either freeze it in time and or destroy it because it can't keep going. There are cells in the body known as fibroblasts. All of you work with fibroblasts because you need the fibroblasts to develop the scar tissue that you need for doing the type of work you do as a surgeon. What is interesting is that iodine destroys fibroblasts. So if you take a surgical wound and you put iodine on that wound and then suture it up and then come back 2 weeks later and take away the sutures, the wound should hold. But if you put iodine on the wound day after day to, quote, keep the wound from becoming infected, when you go to pull the sutures out in 2 weeks, the wound will totally dehiss and open up. Why? Because iodine is toxic to fibroblasts. And it destroys fibroblasts, and if you don't have fibroblasts, you can't make scar tissue. So in a fresh surgical wound, you do not put iodine on that wound because of the effects of iodine on the fibroblast. We're going to focus in on our cretins. Now, we've been looking at the issue, and there's, by the way, right now in the United States, there's a big controversy. Do we give iodine to the population to help us, et cetera, et cetera? And a lot of doctors think that because we have iodine in the salt, that that's all we need. The problem is that in the New England Journal of Medicine just a few years ago, they looked at all the prenatal vitamins that were being given to women, and they found that over half of the prenatal vitamins had no iodine whatsoever. And that was published in the New England Journal. Yet, if you ask most doctors, can we give iodine to my patients? They'll say, oh, there's plenty of iodine out there in the population, and the salt. And the prenatal vitamins, there's half of those vitamins had no iodine. The other thing is that iodine in the salt, many of you are granola girls. And what that means is that basically you sit there and say, oh, I'm not going to get any of that processed salt. I'm going to take sea salt. There's no iodine in sea salt. Did you hear me?
Yeah.
No iodine in sea salt. 50% of you guys are cooking with salt that contains no iodine whatsoever. So that iodine deficiency in this nation is becoming a real problem. And you as dentists, when you've got somebody's mouth open and they can't talk back, that's when you get your chance to talk. And talk to them about salt and the importance of eating salt that contains iodine, eating sea salt that contains added iodine, and so on, okay? Because that's your time to start spreading this message to the population. Now, there was a medical conference held at the NIH back in 1989, and they wrote the article, or the book, it's called Iodine and the Brain. And what they were looking at was the association between goiter and severe iodine deficiency. And what they found was that with severe iodine deficiency, these cretins, that they had IQs down to about 50 defects, and these people have a defect in their hearing and speech. They squint. They have problems with their stance and gait. They have hypothyroidism, and they have stunted growth. In areas of the world where iodine deficiency has been corrected, the incidence of cretinism disappears. And so this is something for us to look at very closely because we're heading back into that direction. When you look at the brain pathology of patients with cretinism, what you'll find is that the brain is atrophic. There are areas of the brain that just do not develop very well. There's dilation of the ventricles and subarachnoid spaces. Microscopic evidence of disorganization of the neurons in relationship to each other and the lack of development of the pyramidal and Purkinje cell systems. Now, folks, let's look at the brain right quick. The brain is basically made up of neurons, and the brain is made up of glial cells. The glial cells are the support cells of the body. The glial cells will differentiate into many of the different support cells that are necessary for the neurons to work. Neurons basically are cells that have a input, a thing where a neuron will ask the question, do I say yes or no to this particular concept? And so it gets all this input from other neurons and quote, glial cells. And depending upon whether I say yes or no, then the neuron will finally tell the brain, yes, it's a go for a yes, and let's do this and that and so on. But you can alter the neurons by continuously saying yes, 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 okay? Because, or no, 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 depending upon what the topic is, okay? What's interesting is that the pyramidal and the Purkinje cells are part of the glial cell system, and these cells are responsible for helping to give organization to the neurons that are inside the brain. Cerebral atrophy with increased cell density and increased percentage of non-differentiated neuroblasts. This is the brain of patients with cretinism. You will notice that they have increased cell density. What's another name for that? Hyperplasia. They have hyperplasia, but it's a hyperplasia that it's just packed in there, but they don't, the cells don't know what to do with each other. And there's increased percentage of non-differentiated neuroblasts. That is, these are young neurons that are just trying to decide, like, what am I supposed to do? And so the glial cells will come and say, you need to become a this, you need to become a that. I'm personally a glial cell in my practice. Reason, I have patients who are young people, they're teenagers. They come up to me and they're very bright kids, and they sit there and say, what should I become? What should I do with my life? And I'll say, let me see your hands. And they got little small hands, and they're very bright people. And I'll say, I'll tell you what you need to do. I'm a glial cell, and you're a neuron, but I'm going to tell you, you need to become a dentist. You need to go around relieving the world of the mercury that's out there. But you need to become dentists, because we need more intelligent dentists, that can make decisions for for how to help people with their health. And luckily, I think we've got a total of 5 kids in the practice who have all become dentists at this point. And they're either in dental school or they're already dentists. But it's basically, you guys help to do the same thing. You got kids who come into your practice who can't decide what to do with themselves. Turn them into dentists. You guys have more influence. My son's a dentist, and he sat there and said, Dad, I cannot believe how many people will sit there and say, I've got these rebellious teenagers. What should I do with them? Or I've got this, or I've got that, or my marriage is on the skids. What do you think I should do? And so on and so on. He said, I'm doing more counseling than I am dental practice, And I said, yeah, and that's a real problem, isn't it? Because you're 27 years old, you're not married, and you got all these people asking you for their opinion about how to raise their families, So basically, we need very intelligent dentists who have a broad spectrum of life, who can help the rest of the population make the decisions that they need to make. It's interesting that we see cellular cerebral atrophy and increased cell density in patients with cretinism. In the thyroid, we see hyperplastic thyroids. lots of colloid, multinodular goiters. Some have atrophy, some have sclerosis, and then there is, and that's where you see the increased scar tissue in the thyroid. The thyroid actually scars down, and the breast tissue loaded with scar tissue. And again, it's unregulated scar tissue formation because the fibroblasts have nothing to tell them to pull back. Okay? We have seen that I was down in Ecuador 1 year ago, and I gave some lectures at 5 different medical schools. Three medical schools down in Quito. And they talked about an area of Ecuador called Tocachi, and the other one is Esperanza. And what they did is that they went in there, they got all the women of one village who were pregnant, and they gave them a shot of iodine, long-acting iodine, and the other village they left alone. They followed the children that were resultant of those pregnancies. And at 15 years old, the kids who got iodine in the pregnancy had IQs that were about 10 to 15 points higher in their respective village as compared to the village where they got no iodine whatsoever. All they had to do was just give them iodine, a shot of iodine during the pregnancy. They went back and looked at the timing of when they got the iodine, and they found that the sooner you got the iodine into the pregnant mother, the higher the IQ the child had. And so, this was actually done down in Ecuador back between the 1960s and about 1986. And one of the original researchers was one of my colleague that I worked with down there last year. So the concept is when a fetus was first getting iodine in the first trimester of life, the baby had a much better IQ and also had a much better social life than those that were not getting iodine. In the case of iodine deficiency, the major central nervous system damage is already irreversible by the time the baby is born and can be prevented by correction of the maternal iodine deficiency early in the pregnancy. So one of you guys came up to me during the break and said, I got a loved one that's pregnant. When should I start her on iodine? Answer, as soon as possible. From the moment she thinks she's going to get pregnant or that she knows she's pregnant, get her on iodine. And how much? In Japan, the average Japanese eats 13.8 milligrams of iodine per day. We have iodine pills in this nation that are 12.5 milligram pills, and so we ask the patients, start taking 12.5 milligram, okay? And you will end up with a baby that's, iodine stimulates the making of the glial cells of the brain, and iodine will give you babies that are geniuses. We have got in my medical practice right now close to 44 babies that have been born with where the mothers took iodine throughout the whole pregnancy. From the moment they knew they were pregnant, they started taking it, and we've got 44 children that are now multilingual. They have, they're very intelligent, and these kids know it. I have one that's 3 years old right now in the practice, and she, her parents were going off to a party with some of the other children, but they sent the little 3-year-old home to be with grandma. And so the grandmother is listening to the child as she's brushing her teeth, and the baby at 3, is standing there in the mirror, looking at herself in the mirror, is thinking and speaking to herself and saying, those people think I'm really stupid, but I know better. I know I'm extremely intelligent. In fact, I'm more intelligent than they are, but I'm going to have to learn to hold my tongue until the appropriate time. This little 3-year-old was saying that in the mirror, and Grandma heard that. But, Now, folks, some of you in this academy have got grandchildren or children that are in this category. I will give you one name right now. That's Dr. Joe Palmer and his wife, Marcy. Marcy, would you stand up for a second? Folks, if you want to know what a child looks like who is a genius, in fact, I think my next lecture should be called How to Raise a Genius When You're Not One. Okay? Because, and Marcy will vouch for me with the fact that they've got a grandchild that is an absolute genius, and it's hard to keep up with these kids. You can't teach them fast enough. And you teach them one time, they've learned it, and they've got it. These are the types of kids who will work 5 puzzles, 50 pieces per puzzle. They would take all 5 puzzles at age 3, put them on the ground upside down, and they will work all 5 puzzles at one time. Okay? That's the type of children we're creating. So that we now know that it's because the iodine helps to stimulate the making of the glial cells that are the support cells of the neurons inside the brain. And the guys down in Ecuador pretty much, when I told them these concepts, they sat there and said, that's exactly what we're seeing. We've looked at the brain pathology of these cretins, and that's exactly what we're seeing. Very little glial cells inside their brains. Iodine helps the glial cells that make up the hippocampus. Hippocampus is where? It's just behind your eye. And right about the level of your temple, and the hippocampus is where you have memory. And they've already been able to show that iodine deficiency will decrease glial cell development in the area of the hippocampus, especially in rats. When you look at the glial cells of the body, glial cells support neurons, providing the brain with structure. They also separate and sometimes insulate neural groups and synaptic connections from each other. Glial cells help to differentiate, you belong over here, you belong over there, these are the things you need to do. The brain of a cretin, it's a total disorganization that's seen inside the brain. Number 2, there are 2 types of glial cells. The oligodendrocytes and the Schwann cells produce the myelin used to insulate nerve cell axons and the cell outgrowths that conduct electrical signals. This particular system, the oligodendrocytes and the Schwann cells, are stimulated by thyroid hormone. There will be people who will say, well, it's low thyroid disease or hypothyroidism that's causing the problems with cretinism. Folks, the thyroid in a normal human being does not develop until 13 to 18 weeks of pregnancy. And as you will see from this previous studies, they need exposure to iodine from the very get-go of life. Iodine to a developing fetus is like caffeine to you guys. You give iodine to a mother who's pregnant, and the baby just becomes wide awake, and it's kicking and moving and everything like that, and it won't give the mother any rest all day long because it's trying to let the mother know, I'm awake and I'm ready to come on out of here. And it's interesting that when these babies are born, typical pregnancy, they last till 40 weeks. These children are born at 36 weeks, and they're fully mature, ready to go. And by the time they're 1 year old, they've already surpassed their colleagues as far as mental development, physical development, everything. Their teeth are coming out sooner than the teeth of babies that are normal babies. And so every parent has told me that. They sat there and said, these kids' teeth are coming out sooner, faster, and healthier at the same time that every other child is still waiting for some tooth to show up. These kids already had their first set of teeth. Okay? So something about tooth development is iodine dependent. so that the iodine in a newborn baby is helping the development of the teeth, and especially in the mandible. Some glial cells are scavengers, removing debris from injured or neuronal death. Glial cells provide important housekeeping chores like promoting efficient signaling between neurons. For example, some glial cells take up chemical transmitters released by neurons during synaptic transmission. During the brain's development, certain classes of glial cells guide migrating neurons and direct the outgrowth of the cells. In some cases, at the nerve muscle synapse of vertebrates, glial cells actively regulate the properties of the presynaptic terminals. Some glial cells help form an impermeable lining to the brain's capillaries and venules. What's that called? The blood-brain barrier keeps certain chemicals from making it into the brain, and these glial cells help to make that blood-brain barrier. Other glial cells release growth factors and otherwise nourish developing brain cells. It is felt by some that human IQ is stored within the glial cells. Human IQ is not stored inside neurons. It is made in the glial cells, and that's where your IQ resides. Iodine stimulates the making of the glial cells in early fetal development, at least in the first 2 trimesters of pregnancy. Look at this. This is looking at if you look at IQ in Japan versus here in the United States, in Japan, the average Japanese is eating 13.8 milligrams of iodine a day. In this nation, we're eating about 150 micrograms per day. We eat maybe 1/100th the amount of iodine as compared to the Japanese. Yet, look at this. IQ development in the United States shows a growing disparity. This was a paper that was written in Nature. They looked at 1,100 Japanese children, 2,200 American children, and they found that the Japanese children on average had IQs between 2 to 25 points higher than the average American child. Which children in the United States on a yearly basis have the highest IQs in this nation? First generation Japanese children who are still eating the sushi, the seaweed, the fresh fish from Japan. The Japanese immigrant, they're first generation children. But the longer they stay in this nation, the lower their IQs become because they want to eat American food, they don't want to eat the foods of Japan. And because of that, then their IQs will start dropping by the second and third generation. It's important to recognize that we can reverse that. We can start that with this generation of people, and every one of you, like what you see with Marcy and Joe, you can influence the next generation of babies that are coming into this world. You can turn every one of those pregnant mothers in your practices into geniuses. And I underword the line genius because it happens. And these kids are some of the brightest kids you've got. My brightest children are the ones from the Indian families where they have to learn how to speak 4 or 5 languages. Indian children have to learn how to speak their mother's tongue, their father's tongue. They have to learn how to speak in Hindi. They learn to speak English. And at school, they have to learn how to speak Spanish. Indian children of India have to learn on average 5 languages by the time they're 15 years old. Okay? And what we know right now is that people who are bilingual have less problems with dementia as they get older. Because where one language may fail, the other one picks up. My mother was like that. My mother could speak Spanish and English, but as she got older, As she got older, she lost her ability to speak English, but guess what? She still reverted back to her mother tongue and could to communicate with us in Spanish. She might have been demented speaking English, but her Spanish was perfect, right on the dot, and she could talk to me in Spanish and get her ideas across in no time. So that we know now that bilingual individuals don't lose their problems with their cognitive function. So I'm going to encourage all of you that if you're not learning how to speak a different language, please try. And especially in our children, we should be teaching the kids not only 2 languages, try to shoot for 3 or 4. We know for a fact that in these babies that are geniuses, they can learn up to 15 different languages, and they can learn to speak these languages very fluently without an accent by the time they're 16 years old. That's how smart these kids are, okay? So, I would encourage you, take a minute, go speak to Marcy, go speak to Joe about their grandkids. It's coming, and we can do something about this, but I've got 15 of them. My oldest one in the medical practice right now is 14 years old. She started when she was in the 5th grade wanting to start taking college courses. What course would you give to a little girl in the 5th grade that's a college course? She wanted to learn how to, she took an English course. She wanted to take English 101. Do you remember how tough that class was? She made straight A's in the 5th grade. This kid right now is in the 9th grade, has already finished 5 college courses, making straight A's all the way through. Okay? So I'm telling you, these kids are phenomenal. And her second class she wanted to learn how to do was PowerPoint presentation. Her father is a Baptist minister, and she, every Wednesday night, comes up to her dad and says, "Dad, I need the sermon for Sunday by Friday morning." She said, "I'm going to put it on PowerPoint for you, and we're going to go over the PowerPoint and the theology of your sermon on Saturday night." So Saturday night, she goes over all the points of the PowerPoint. She said, "You made an error here, you made an error there, this is not in the Baptist whatever." And she lets him know where he made some mistakes. And then she has it all on PowerPoint. They review the PowerPoint together. He reviews it again on Sunday morning. He gives a sermon at noon, and he's got one of the best churches in the area. Okay? All because his little girl wanted to learn how to do PowerPoint in the 6th grade. Okay? So that's the type of genius we have. Today she's in the 9th grade, and she's blowing everybody apart. The local community college can't wait for this kid to show up at their classrooms, because she's going to blow everything. She's going to blow everything apart. Okay? So I would not doubt if she ends up at some Ivy League school by the time she makes it to college. So, but here we see the average IQ in Japan is 25 points higher than the rest of the Americans, all because they're taking that iodine. Now, lack of iodine, you can also get problems with attention deficit disorder. We've been dropping the iodine content in the nation, and so what happens is there was a study done in Italy looking at babies that were created by mothers down by the ocean versus mothers who were living up in Tuscany, up in the mountains. And what they found was that the children that were created in the uterus up in the Tuscan mountains had much lower IQs, and they had more problems with attention deficit disorder. Attention deficit disorder is the beginnings of the intellectual decline as things are declining. And what was interesting is in the papers that I was reading about iodine deficiency, they mentioned one of the diseases as being autism. So they saw autistic children having very many of the same similar types of medical problems as what we saw with the cretins. So all I can tell you is I encourage you, if your child gets pregnant, start her on iodine immediately. If your child is thinking of becoming pregnant, start them on iodine immediatdy. You will not be sorry with the output of the baby that comes out. And Marcy, would you let Joe come up here and speak for a second? This is, you can see what these kids are like, and they can give you the input on this subject. Have you got a mic for them?
Speak slow, Joe. No, I don't know how to do this. So, I got a little video, if you can talk a minute, and I'll pop it in. But our granddaughter is incredible. The vocabulary is just, I don't know how many words it could be. But if you probably pointed to any object in this room, she'd tell you what it is. And she's only like 20 months old.
His granddaughter is about a year and a half old, and most children about that age have a vocabulary of maybe 80 words, and when they speak, it's like 1 or 2 words at a time. Their grandchild has got a vocabulary of about 500 to 1,000 words, and when she speaks with 5-word sentences. And when she goes in for her pediatric, when she goes in to speak, she'll sit there and talk to the pediatrician and have an intelligent conversation with the doctor. And the doctor says, I shouldn't be able to talk to a kid like this.
The pediatrician's amazed. She really is. She said she should have maybe 50 at the time. That's about a month ago. And if I say it, she says it, so you better watch your language, because she can repeat anything you can say. And she counts up to 10, very seldom misses one.
And this is a kid that's a year and a half old.
You'd ask her how old she was, 19 months.
She doesn't just count, she counts objects.
So
Stop at 8.
she's not really into toys. She's into manipulating things. She'll go to my drawer where I keep my spaghetti noodles. You'll ask her how many, and she'll literally point at each one. And one got on the floor, and so she counted to 7. And Joe looked at her and said, well, what about that one? She said 8. I mean, it's just amazing. She's a lot smarter than I am. But it's fun, too, because like you said, if you teach her one thing, she remembers it. So Justin will show you a video of her doing the alphabet.
Yeah, I'm going to tell one quick story. This is not very pleasant, but she had a little stomach bug last week. Thought she was over it, and the kids brought her over before we came right down here. And I looked at her, she got a little green. I said, hey, Joseph, that's my son. I think she's getting really sick. And so Joseph got her, but they didn't get to the bathroom. So she kind of threw it in the middle of the floor. She looked at her daddy, she said, Daddy, I don't want to do that again. That's more than 5 words. So,
Talk about the story when she went upstairs.
Go ahead.
And then her mother, she didn't like to go to sleep. She'd rather stay up with us and play all the time. And her mother said, it's dark, it's time to go to bed. She looked at her mother and said, just turn the light on.
Does she have her grandmother's accent?
Of course. You'll hear it here in a minute. I hope you'll hear it. The volume. Where's the volume? Where's it for? It's not working.
Now, I've had the privilege of watching 44 of these kids grow up, and they're all following the same pattern. They all are mentally developing very quickly. Their motor skills develop very quickly. By the time they reach age 5, they all of a sudden take off. You can't stop them. Mentally, they are some of the brightest people you've ever found. And the biggest problem is that we as grandparents and parents have got to learn how to raise a genius. These kids are so smart. We're not used to the fact that there can be geniuses amongst us. And these kids are all genius. And so, the problem is, how do you raise a genius when you're not one? Okay? Go ahead.
So we'll see if this works. What you got?
Can you do it?
So I don't even have to do that. Perfect ABCs at 20 months.
So she at 20 months has already got her ABCs down, and she's learning the concept now of 1 equals 1 noodle equals the number 1. And so, what else is she doing at this point?
Books are a favorite of hers. She would rather have a book than play with a toy. She's not really into dolls and different things like that. Her motor skills, we were afraid, were a little bit delayed, but once she took off, because she wanted to sit and read, she wanted to sit and talk, she wanted to do all of that interaction with you, and we were a little bit concerned that she wasn't walking like other children. But once she decided it was time to walk, there was no taking back. She didn't stop. She didn't stumble. She didn't have those falls that a lot of children have. She can pick up anything she needs to pick up and bring it to you and tell you what it is on the way to bring it to you. And ask, where's the dog? She knows her possessive. She calls me Cece. This is Cece's. This is Papa Joe's. This is Daddy's. This is Mama's. She knows everybody by sight and picture as well as in person. And we just, I don't know, my children just didn't do that.
She got a little kitchen set for Christmas, and a really nice one, a little stove and all this stuff, all these little plastic things of food. And I'm going, it's way too early to give this kid something like this to play with. By the time we had it set up and unpacked, she was we'd tell her, make somebody a tomato sandwich. She'd take the little pieces of bread and take them over to Uncle Ricky. She'd take tomato and put in it, take it over Ricky. She wouldn't grab the asparagus and those squash and other stuff. She knew those were tomatoes, just like we filmed it. Tell her one time what it was. It was amazing.
Yes. And so, I just want to let you know, this system does work. We can generate children that are very high IQ. And this organization here, look, I have, as one medical practice, I've got 44 children within the last 10 years that have now all been born and done this. Each one of you over over the next 10 years can influence 44, maybe 100 pregnancies of people to take iodine throughout their pregnancies. I will guarantee you, you won't be sorry. And the families will be praising your name, for the fact that you took them down this road. Okay? Thank you.